Welcome to this Medmastery coronavirus update. I'm Franz Wiesbauer. I'm an internist trained in epidemiology and public health at Johns Hopkins and the founder of Medmastery, where we teach important clinical skills to doctors and other healthcare providers around the world. Today we're going to talk about herd immunity and how to stop an epidemic. Let's get started. So what is herd immunity? Well, it's a basic principle that's used in combating epidemics. Herd immunity occurs when a significant proportion of the population or the herd have been vaccinated or are immune by some other mechanism, resulting in protection for susceptible individuals. Let's see how this works in action. In a previous video, we talked about R naught, the basic reproductive ratio. Let's look at this example where we have 1 diseased or infected individual and 18 susceptible individuals. As you might remember, R naught is the average number of individuals an infected person gives the disease to. R naught is fairly constant for a given disease. R naught for the novel coronavirus, SARS-CoV-2, has been estimated to range somewhere between 2 and 3. So let's say this COVID-19 patient gives the disease to these 3 individuals. And let's say these 3 individuals give the disease to 3 other individuals in turn. Then this is what the situation will look like after some time. Now let's assume that we vaccinated some of these susceptible populations such that they became immune to the virus. Now the virus can't infect the individuals it infected in the previous scenario. Now our index case only infects 1 other person. And due to the immunity or herd immunity of the group, this newly infected case can also only infect 1 other person. What we've done here is to reduce the basic reproductive ratio of 3 to an effective reproductive ratio of 1. As we've seen in a previous video, when R is equal to 1, the disease remains stable and won't grow. The herd immunity threshold is the proportion of a population that need to be immune in order for an infectious disease to become stable in that community. Or in other words, in order for R to become equal to or lower than 1. If this is reached, for example through immunization, then each case leads to a single new case and the infection will become stable within that population. So how do we know what proportion of the population needs to be immunized in order to reach herd immunity? Let's look at a disease with an R naught of 8, where 1 infected individual infects 8 others on average. What would need to happen for them to only be able to infect 1 other person? Well, we would need to immunize these 7 over here. So 7 divided by 8, or 7/8, is the herd immunity. It's calculated as R naught minus 1 divided by R naught. As we've learned previously, R naught for SARS-CoV-2 is between 2 and 3. So how many people would we have to vaccinate if there was a vaccine in order for the epidemic to stop? Well, that's 2 minus 1 divided by 2, which is 1/2 or 50% if R naught was assumed to be equal to 2, and 3 minus 1 divided by 3, or 2/3 if R naught was assumed to be equal to 3. So according to this calculation, we'd have to vaccinate between 50 and 66% of the population. Now, I recently heard Mark Lipsitch, an epidemiologist from Harvard, mention in a podcast interview that the herd immunity of COVID-19, according to his data, was around 40%. I'm sure he has more complex tools to factor in other variables that could influence herd immunity. But if you want to go by the books, the calculation of herd immunity according to the formula we provided is valuable and valid. By the way, I really recommend you follow Mark on Twitter. He provides great insights about the epidemic and seems to be a super smart guy. That's it for now. If you want to improve your understanding of key concepts in medicine and improve your clinical skills, make sure to register for a free Medmastery trial account, which will give you access to free videos, downloads, and updates. We'll help you make the right decisions for yourself and your patients. If you like this video, make sure to subscribe to our YouTube channel so you'll get notified when we publish new videos. See you soon.